Hi there, my name is Dustin Bingaman. I'm a licensed psychologist, and I've been asked to give you some information about PTSD and how it impacts women. The first thing I'm going to go over with you is what is PTSD. So PTSD stands for post-traumatic stress disorder, and it is an anxiety disorder that's kind of characterized by experiencing some sort of trauma, and then you have symptoms that are related to re-experiencing that trauma. Kind of some symptoms that are often expressed by those that have PTSD are things like flashbacks, nightmares. Very common symptom of PTSD is nightmares. A lot of times during the day or during the waking hours, they'll have what we call intrusive thoughts, which are vivid memories of the traumatic event. And those are obviously unwanted and kind of coming to them when they're not wanting them to. Negative alterations in mood, very hypervigilant. You can have angry outbursts, and often you have sleep problems associated with trauma. When we look at things that could be considered trauma, there's a wide variety of things, but things like war, sexual assault, natural disaster, a bad car accident, seeing somebody die, violent crime. These would all be things that would fall under traumatic events. And you don't necessarily have to experience it firsthand. You could be an observer of these events and it still can be diagnosed with PTSD. Some stats that kind of relate to women. Women are twice as likely as men to develop symptoms of PTSD. 60% of men and 50% of women experience at least one traumatic event in their lifetime. For women, being sexually assaulted is probably one of the most common traumatic events that they experience. And about half of the women that are raped would go on to develop symptoms of PTSD. And obviously, the more serious the trauma, the more likely it would develop into PTSD. 1 in 10 women will develop PTSD during the course of their lifetime. Women that are in the military would also be vulnerable to symptoms of PTSD just with the higher rates of sexual assault and in conjunction with maybe some combat exposure. During any given year, approximately 8 million Americans have been diagnosed with PTSD. Some differences in how men and women might experience that. Men tend to be more agitated or angry after a traumatic event. Women tend to have more anxiety and feel more symptoms of depression. Women tend to experience those trauma symptoms longer than men. They're less likely to abuse drugs or alcohol, which is a real positive. Men tend to be more likely to turn to substances, and that generally isn't a good outcome for them. And women are more likely to seek help after a traumatic event, which is another positive. So, some other risk factors that you need to consider when looking at PTSD. If you have a prior mental health history, that would make you more susceptible to developing PTSD. If the trauma lasted for a long time, a lot of times with sexual assault, that could be a reoccurring thing. That would be a risk factor that might make it more likely for PTSD to develop. Not having a good support system, you'll meet a lot of people when you ask them about who their supports are, they'll have a hard time identifying one person. In the case with sexual assault, a lot of times trusting other people is a real problem, so lack of a support is definitely a risk factor. And using substances, which I already talked about, and the more seriously hurt you are physically, the more likely it can turn into PTSD. And of course, if you think you might have some of these symptoms and you're looking for some professional help, you can contact us here at the Ptsd Hospital Counseling Center. Thank you.